very much.
That was pretty cool. We don't normally get walk-up music.
No, that was actually, that was very exciting, actually. So, well, listen, I'd like to take the time to thank everybody for the opportunity to come to speak to you. This is actually a very special event for me personally. 15 years ago, maybe actually 16 years ago, I actually left industry and decided to join a startup by the name of Member Health, who was known as Community CCRX, and launched into the Medicare Part D program in the fall of 2005. And I've spent the last 15 years building the largest Medicare Part D program under the leadership of CVS with SilverScript, and I know this program really well, and it was that basis for the request of the secretary to say that I may be able to provide some value in understanding how the business aspects of Medicare and the PBM and the network works, and how to support and improve the market moving forward. So I'm very excited about being here. I congratulate everybody in the room, and the fact that we are here today and have developed the program the way it is and how it's well received is really a contribution to everybody that's in the room. I'm here this morning to really speak to the blueprint and really the things that we are focused on at HHS as it relates to the president's goal of reducing drug pricing for all Americans. As you know, this has been an objective of both the president and the secretary, and I'm here to share with you that we have a tremendous amount of things that are going on that we're excited about, that I think we're laser focused on, and working across the organization of HHS to hopefully deliver on more value. As it was pointed out in the blueprint, the president has made it clear that the challenges in the market today are the fact that we have these higher list prices that are in the marketplace, and we really need to find 4 areas of focus. And those 4 areas of focus that we're focused on now is, one is to really improve competition. And I see that really in the FDA. You know, what are the things that are going on in the FDA? How do we end the gaming that's going on that eliminates or prohibits generic manufacturers from entering the market and bringing down the cost of medications? I think another one that's very near and dear to my heart, and the things that we were looking at is the development of a biosimilar market that can actually penetrate the market and actually be a cause for change in how pharmaceuticals are spent in the marketplace. So I think you'll see with the improved competition that the biosimilars market becomes something very important that the FDA is working on. The next area is to really improve negotiations and make sure that we're doing that in a number of different areas. When we think about the areas in Medicare Part D has been a great leader as it relates to how the market has sort of conformed over the last 15 years. And with that said, as the commercial market has come in and picked up some of the valuable tools of the Medicare Part D program, we've actually started to see the Part B the commercial market be a little bit more sophisticated as it relates to its ability to manage cost a little bit differently. So I think we'll be looking at areas that allow us to provide the same level of service to patients, but also bring more negotiations in areas where we lack the negotiations to help bring down cost in the program. The third area is obviously finding areas to motivate the reduction of list price, or motivate the ability of motivating manufacturers for not taking high price increases. And in that, what will drive, hopefully, a lower out-of-pocket experience for consumers in the general market as we see it. So with that said, when we think of the 4 pillars that we believe will get there, we've really made 4 commitments this year that we are focused on in trying to drive that value proposition into the marketplace. First and foremost, we think if we're going to go into an area of transparency, that it is important that consumers have a general understanding of the list price of the medication. And so as medications are delivered in DTC, we ask the question, would it be helpful for members to better understand what options are out there available to them, and in list price, in DTC, is list price a valuable tool for consumers to have a better understanding? The second area that you've probably heard a lot about is today in the marketplace, everybody except the patient wins when price goes up, based on the fact that everybody, whether you're a wholesaler, a PBM, a plan sponsor, gets higher rebates in the marketplace. So the question that's been contemplated is are rebates driving higher list costs, which members who are paying in the deductible or members that are paying in a co-insurance environment are actually paying off of a list price that continues to go up. Should we reevaluate and reconsider what the safe harbor around rebates, and should that be reevaluated in a way that would bring lower costs to consumers at the point of purchase? And then third is really unleashing Part D, really giving Part D tools that allow them to continue to drive more and more savings into the program. What are the things that may be going on to the marketplace today that Part D has not been as focused on historically? So what are ways that we can improve the STAR systems, the CDNA perspective, to make sure members get what they need, and at the same token, the plans are given the opportunity to continue to drive manufacturers to come to the table. And then finally is really around list price and what we can do from a transparency perspective, and also bringing negotiations potentially to the Part B program. Today, the Part B program is close to $30 billion, and we have very limited ability to bring manufacturers together and find ways to drive value into the marketplace. So what can we do to encourage and engage the market to bring needed savings to a very fast-growing segment of the Medicare overall spend?
Well, thanks, Dan. And I think you've outlined the important work that we have ahead of us and the way that we're going to go about it. And I, too, want to thank everybody in this room and congratulate you on all the work that you've done to make the Part D benefit a success. I'm a pharmacist who became a pharmacist when my mom got sick. I wanted to be a sports broadcaster, but I became fascinated by how well prescription medicines could actually help people get well and stay healthy. Both the science of how two pills that looked the same could act so differently, and the personal experience of how some drugs in even the same class could help mom be mom, and as a mental health consumer, not help her as much. So to have an opportunity 15, 16 years ago to be involved in rolling out this program, working with patient groups, big shout out to all the pharmacy students who may be watching on the live stream who 15 years ago were so active in helping people understand what to look for in that first enrollment period in 2005 going into 2006. But there's many people, of course, at the department who were equally involved in creating the policy and rolling this program out. So on behalf of the Secretary, the Deputy Secretary, CMS, and everybody back at the Humphrey Building, thank you very much for having us here today. We recall and fondly remember that it wouldn't be as successful if not for you. I do want to echo what Dan said about the importance of negotiation. In many instances, it is difficult, if not impossible, to negotiate lower prices for consumers without managing utilization. And when the Secretary has participated in the many roundtables that we've had with patient groups and provider organizations on this topic, he's made it very clear that you are at the center of all the policies that we are evaluating and the policies that we've most recently rolled out. And think about the Medicare Advantage changes that we announced for 2019 and 2020 that were, again, intended to help create the leverage to allow Medicare Advantage plans to bring lower drug costs and ultimately, in the future, savings and lower premiums to beneficiaries. But that can't be done without important patient protections. And when the Secretary met with patient groups, he made it clear that you're at the center of what we do. He explained the patient protections that we've built into the program and are thinking about for all of the work that we're doing, and said, when this goes live, if it isn't working the way that we're describing it today, I want you to first call me, the Secretary, and then I want you to call the administrator and let us know if folks aren't implementing these changes in the way that we're describing them here today. And he also encouraged the plans in a number of venues to look for ways to implement these changes in a way that decreases provider burden. Technology has come a long way in the last 15 years, and the ability to reduce the cycle time or streamline the process between the patient receiving a prescription for a drug that may not be working as well for them to the one that ultimately they and their doctor believe is going to work best for them is an important part of our work. The comment period may have ended in July. We may be a little less popular than we were back then, but our door remains wide open. We are keenly interested in hearing from patient and provider groups. We've been encouraged by the informal meetings that we've heard between patient groups, provider groups, manufacturers, PBMs, plan sponsors, who are working to find common ground to be able to inform us of ways that we can be successful in exactly what you've described we're working toward. So if you have ideas for us, if you're concerned about things, I think everybody knows how to get a hold of Geraldine, and we'd be happy to see you in the counselor's conference room. So to close, I do want to again reiterate what Dan said. We wouldn't be here without you today. We recognize how important you are to all of the work that we have going on, and that everything that we'll do going forward, we really want to increase competition, improve negotiation, create the incentives to lower list prices, and ultimately lower out-of-pocket costs for consumers. We believe strongly in the value of innovation and recognize that better medication use, better adherence, getting patients on the right drug at the right time and keeping them on those regimens can lead to lower total medical costs, something that you've pointed out in the report that you're releasing here today. But all of this is done with the patient at the center of the room. And we appreciate all of those who are here today representing patients, and we look forward to working with you again soon. Thank you very much.
Thank you.